Good morning, everybody in the US, and good afternoon for those of you in UK, and good evening for those of you in India. I'm Dr. Swami Iyer from Houston. I'm a professor of medicine at MD Anderson Cancer Center. We have the great pleasure and a therapeutic program today. And as you know, we have been engaged with trying to mitigate some of the issues that's going on with COVID across the world, particularly India, with the second wave. Many of us have come together for this purpose, and one such endeavor is this platform called Telavaid or Telavaid, which started as a tele-education with the objective of providing a telecom platform for healthcare workers and clinical education around patient management during the COVID crisis in India. It's an important mitigation measure. As you know, the system could not handle what happened in India. And we, as Indians who've lived outside of India for such a long time, felt helpless. And this is one way for us to help our fellow medical professionals and the people to try and improve the situation. It's all volunteer-based. We have tied up with various organizations. Telavaid is a collaboration between CareInc. CARE stands for Collaborative Action for SARS-CoV-2 Eradication. It's a non-for-profit 501c in the US, along with PathCheck Foundation, which is started as an initiative by Dr. Ramesh Raskar, who's the head of the MIT Media Lab from Massachusetts Institute of Technology. A very rapidly growing organization, which has done a lot of work on digital infrastructure for COVID. So as this came along, as you can see, we had to come up with some solutions. We also collaborated with Teladoc, a UK-based company, to provide this fast response 24/7 and advice based on condition, and to lower the pressure on hospitals and hospitalization. And this being the case, and as the second wave has passed through after various efforts, I should say that the threat is not completely gone. So we have still regrouped to provide ongoing education in a slightly different form through webinars. And today what you'll hear is a therapeutic approach to how we can come out of this COVID situation. It's not just the disease, it's the mind, body, and spirit. What you will see is something that the mind and the spirit will definitely enjoy. It has its healing effects. Without further ado, I want to hand this over to Dr. Priya Ramaswamy, who is an anesthesiologist at UCSF, to speak about our guest today, Dr. Tara Rajendran. Priya.
Welcome, everyone, and welcome, Dr. Rajendran. So it's my pleasure to introduce Dr. Tara Rajendran. She is a doctor, a classical musician, a Rhodes Scholarship finalist, and a TEDx speaker. She's currently pursuing a PhD in classical Indian music, and her specialty is Veena. Her dissertation focuses on the evolution of the use of Indian classical music in medicine. She is India's leading advocate for including music into the Indian palliative care arena, and also the oncology infrastructure. Dr. Rajendran founded Oncology and Strings, a self-initiative lecture concert advocacy program. So without further ado, I welcome Dr. Rajendran to continue and teach us all about music and medicine.
Thank you. It's a pleasure and privilege to be here. I would like to thank Dr. Priya Ramaswamy, Dr. Swaminathan Iyer, Medha Naik, Dr. Rajiv Gupta, PathCheck Foundation, CareInc, and the entire team family of Telavaid. And thanks very much for having me here. I'm going to share my screen now. In today's session, I am going to navigate you all through the neurochemistry and neuroanatomy of music. Subsequently, I will walk you through the distinction between music versus music therapy interventions. And I will also touch upon the relevant clinical trial / meta-analysis outcomes and how I founded oncology and strengths, the relevance and challenges. I'm so sorry, something has happened to my slide. Oh. The relevance and challenges and music's applicability in the COVID-19 context. And I'll conclude with a Wiener recital. In 2008, German archaeologists discovered this 35,000 years old vulture bone flute, which researchers argue that ancient Homo sapiens used music as a form of communication and to enhance the social bonds. When we look closely at the academic music therapy frontier, we would find that after 1999 and millennium, there was a sudden surge in the number of studies in music therapy. One of the most important reasons is this remarkable study that was published by Nature in the year 1999. This work was done by Dr. Ann J. Blood, and this is about emotional responses to pleasant and unpleasant music correlate with activity in paralimbic brain regions. The authors examined the cerebral blood flow and reciprocal cerebral blood flow using positron emission tomography in 10 volunteers. So the two most important take-home messages from this seminal work is, one, music can induce real emotions because the activity of core structures of emotion processing was modulated by music. And two, there are affective disorders such as depression and pathologic anxiety whose dysfunction, they are partly related to the dysfunction of amygdala. And now music is also said to modulate the function of amygdala, modulate amygdala. So the empirical basis for music therapeutic approaches for affective disorders such as depression and anxiety would be this. Now, not as a trained musician, but as someone who enjoys the aesthetics of music, there are very often moments where when I listen to a particular segment of a musical composition or crescendo or so, I get goose flesh and I well up and there'll be chills running down my spine. So in 2001, the same authors, Dr. Blood et al., found that when they scanned the brains of musicians who experienced chills of euphoria, not when they were singing music, not when they were playing an instrument, but when listening to music, they found that the musical activities are kind of activating the reward system that are stimulated by food, sex, and addictive drugs. Now, a PET study, so how they conducted the study is a positron emission tomography study on musical frisons, these crescendos. And now these crescendos might vary, these frisons may vary, but from person to person. But the analysis was the PET study on these musical frisons, making use of a radioactive marker, 11C-raclopride, to measure the release of neurotransmitter dopamine at synapses, which indicated that neural activity in the ventral and dorsal striatum involves increased dopamine availability, probably released by dopaminergic neurons in the VTA, which is ventral tegmental area. So this indicates that music-evoked pleasure is associated with activation of the mesolimbic dopaminergic reward pathway. Now, this is the same thing that regulates memory, attention, executive functions, mood, and motivation. Now we kind of know that how in cancer patients, when we are giving musical interventions, their mood disturbances improving they have a good quality of life, sleep quality. And in Alzheimer's disease, the symptomatic management is occurring due to musical interventions. So this is the basic tenet behind that. A key part of this reward system is the nucleus accumbens, which regulates mood and pleasure. Now, coming back to 1999 study, the neuroanatomical regions demonstrating the significant reciprocal cerebral blood flow correlations with chills intensity ratings. A, B, and C shows a positive correlation with increasing chill intensity, and D, E, F shows a negative correlation. This is a diagrammatic representation of the main pathways underlying the autonomic and muscular response to music. The activities observed by functional neuroimaging in this brain section is initiated by musical frictions involving experiences of shivers, maybe tears in the eyes or goosebumps. This brain section is sensitive to primary rewards like food, drinks, sex. This shows that music-evoked pleasure is associated with the activation of a phylogenetically old reward network that functions to ensure the survival of the species. Now, the network seems to be functionally connected to auditory cortex, which is there right in the center in sky blue color, AC. While listening to music, the functional connectivity between the nucleus accumbens, which is right there in orange, NAC, and the auditory cortex predicts whether individuals will resonate with the song or not. Now, the second part of the image, which is hippocampus, there is a growing body of evidence that says hippocampus is involved in emotion due to its role in the HPA axis stress response, hypothalamus pituitary adrenal axis stress response. And the hippocampus appears to be involved in the music-evoked positive emotions that have endocrine effects associated with the reduction of emotional stress effectuated by a lowering of cortisol. I'm sorry, slip of tongue. Okay, so this is an important study of 2017 Lancet Neurology. So this kind of summarizes all of the rehabilitative effect of music. There are 3 segments of this study, which is the blood flow and increased blood flow. The second one is the cardiovascular response, and the third one is the endocrinology. So when coming to the first one, the blood flow, so music induces widespread activation of various networks in the brain and correspondingly increased blood flow through medial cerebral artery because of the autoregulation, which should provide favorable circumstances for recovery in general. So for instance, in stroke recovery, after stroke, neuroplastic changes associated with functional recovery are activity dependent. So when music is provided, so musical activities bear a similarity with the concept of enriched environments in animal models, and that facilitate a recovery both at the behavioral and neurological levels in again, in animal experiments of many neurological illnesses. But that said, however, we at the moment do not know the cellular mechanism of music-induced neuroplasticity. They remain still unknown and researches are going on. Now coming to the second part, which is the cardiovascular responses. Now, music modulates brainstem mediated measures, which are pulse, respiratory rate, blood pressure, heart rate, skin conductance, muscle tension. So there are 2 kinds of music. One is stimulating music, exciting music, which would be rock music or EDM, and relaxing music. When you listen to a stimulating music, these brainstem mediated measures, which is like pulse and respiratory rate, tend to go up because it's an exciting piece of music. And when you listen to relaxing, soothing music, that comes down. That's that. And moving on to the third segment of this image, which is the endocrinal effect. So they are kind of, this picture is basically for a stimulating music. So they are saying the stress hormone is being released. So now there is a polarizing outcomes with respect to cortisol. So some studies, they say when they have given stimulating music, cortisol is going up. And when you listen to relaxing music, cortisol levels are low. So yeah, so it's not like when you listen to any kind of music, the stress is coming down. So there is a distinction. Yes, so now coming to the neurochemistry of music specifically, that is considered to be the next great avenue of academic music therapy, avenue for research. So this study is published in Cell Press Trends in Cognitive Sciences 2013. And this study is particularly remarkable because they kind of analyzes 400 reviews, like all kind of researches in endocrine neurochemistry of music up until 2013. So they found that music influences oxytocin, cortisol, adrenocorticotropic hormone, epinephrine, norepinephrine, beta endorphin, growth hormone, natural killer cell count, interleukin-6, and immunoglobulin A. As I said, it's the first large-scale review of such a vast number of research papers. And what they found that both listening and playing music will have clear benefit. And music was found both to improve the body's immune system function, because as we saw, the immunoglobulin and interleukin-6 and reduce levels of stress. And listening to music was also found to be more effective than prescription drugs in reducing anxiety prior to surgery. So there are two important studies. One was conducted in the Cleveland Clinic, and second one at Memorial Sloan MSKCC New York. That was with the breast cancer patients, and pre-surgery there were two wings, one with the musical wing and the control wing. And the musical wing was divided into two, live music and recorded music. And what they found was the live music wing required much low dose of anesthesia compared to the control dose. But again, the sample size, I mean, we need perhaps a larger sample size for a conclusive evidence, but yes. Now, this is not technically a neurochemistry, but I found this really fascinating. This is the corticospinal tracts of both hemispheres. And figure A is of a child non-musician. Figure B is an adult non-musician. So when we compare A versus B, we can see that obvious maturational changes from childhood to adulthood. The corticospinal tracts are stouter. And C is a keyboard player, adult musician. And we can see when B versus C itself, the thickness has gone up. So A versus B versus C. The additional adaptation of this important motor tract is an adult keyboard player whose requirements are to make fast, precise, and coordinated fine finger movements. When I started this advocacy program, Oncology and Strengths, for over 2 years now, I think the most important frequent question that's been asked is, I mean, we relish music, so why don't we just give music rather than you are, I think, focusing too much on research and all of that. Like, why don't we just listen to music, and why don't we just play music for patients like cancer patients, etc. So it might be a little really basic for the countries who already have introduced music into their academic curriculum, but training programs. But for many of the countries like India, developing countries, third world countries, we although have a large repertoire of musical cultures, musical genres, we have massively underutilized its potential in healthcare infrastructure. So we haven't incorporated it yet. So because of that, I think there is a lot of doubts, and there are no, board certification. There are no licensed music therapists. So there are kind of people who say that, listen to this music, this is for arthritis. Listen to this music, this is for pneumonia. And all of these are not backed up by any kind of scientific research, peer-reviewed research. So I'm not saying music cannot be one of the music therapy interventions, but this is for clarity. So these This video is something I took as a sub-intern in November 2018 in Pediatrics, Mount Sinai West. So Mount Sinai has a very good music therapy training program, and their interns keep shuttling to the hospital. And this is a video I have recorded. So this intervention is basically an ocean disc. This is not a musical intervention, but rather a sound intervention. So when premature babies are taken up to ICUs, they are really not comfortable because the unnerving and numbing beeps from the monitors, and they are like suddenly taken away prematurely from their mother. And I think the only sounds that comfort them are something they are familiar with. There are two sounds like that. One is maternal heartbeat, and second one is the whooshing timbre of amniotic fluid. So now ocean disc is a large disc where there are metal beads, and that emulates the sound of whooshing amniotic fluid. So let me play this for you. I don't know why it's not playing. Oh.
Yeah, like that.
So this is the sound the fetus will be listening to.
Yeah. And sometimes we try to fit with their respiratory rate, like if it's too fast, and then gradually get slower to make it more calm.
Okay. This is Gatto box, which is a wooden box. Usually we use a mallet, but that'll be really incongruous for a baby. So we use fingers to tap lub-dub, lub-dub, lub-dub. This is invoking the sound of maternal heartbeat. I was trying to play this. I don't know, some tricky. Okay, I don't know. This is a public broadcast service video I took. This will actually give you an insight of whatever I have discussed before. And you can actually see a big...
The fetus hears the mother's heartbeat 26 million times before the baby is born. So with this Gatto box, we can actually recreate the heart sounds. Yes. And she's very responsive to rhythm. The Gatto box is actually a drum, but we use it without the mallet as a box. And we try to entrain to the baby's heart rate so that we create a rhythm for the suck. Much like if you went to the gym and you went on the treadmill and you played music, you would entrain to that beat. It would help you work out. The rhythm would support your movement. We use it without a mallet because it would be too jarring. You'll notice it's a kind of quiet sound, and it's enclosed, much like the baby would experience in the womb. She's so sensitive to tone. We expect the heart rate to go up a little bit in the transition. So we saw that at the beginning it was high, 189, 190. But then very soon the baby was stable, transitioning into from quiet alert to almost a sleep state.
Notice this. Slept off. So there are scientific studies that back this up. So again, the study is from the Louis Armstrong School, Mount Sinai's music therapy training program. So we could see that the heart rate, if we, in Gatto box column, you can see during the intervention, the heart rate has gone down. And with respiratory rate, ocean disk, when the ocean disk column, the middle one, has gone down. And with sleeping over 2 weeks, the percentage of time of active sleep is obviously controlled to compared to control group. It's an obvious like increase in sleep quality and the hours of active sleep. And sucking behavior, yes. So that both with Lullaby and Ocean Disk and Gatterbox, with Ocean Disk and Gatterbox, it has improved compared to the control one. Oh, yes, I forgot to say, and this study was conducted with among 272 premature infants and who were with respiratory distress syndrome and sepsis and short for gestational age. And they gave kind of 3 interventions per week for 2 weeks. Yeah. Again, I think this would be a little basic for for the US and UK, because but I really want to stress this upon, because there is a lion's share of countries where music is not still an established healthcare profession. So American Music Therapy Association defines music therapy as the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed approved music therapy program. So whatever I have highlighted in white is not there in countries like India. So for example, evidence randomized control trials with statistically significant outcomes, we don't have that for music that's tailored to Indian diaspora, and interventions, individualized goals, and credentialed professionals. So we don't have a program, so hence no credentialed professional. More or less the same definition for British Association for Music Therapy as well. There are 2 variants of music therapy. One is clinical and second one is therapeutic. The videos I have showed, the pictures I've showed is clinical music therapy, one-on-one, but there is a large spectrum of musical interventions in active/clinical music therapy, which are like playing an instrument, or like this picture, actively listening to music, or or tapping your hand or clapping the hand when listening to music, or making some movements and according to the rhythm of the music. And the second one is therapeutic music. So that is like passively listening to music. Apologies. Again, this would be a really basic content for the US and UK, but if you have seen a hospital, in India, 99.9% is like a crowded reception and there is no music. Forget live music, there is no recorded music as well, because there is no infrastructure for this, I think, PA systems. When I'm stating these facts, I'm not meaning in a disparaging way, but I think it's important to recognize where we stand, because then we can plan accordingly to implement an action. This is a study, again, 2017. There were 78 patients, 39 each in the music and the non-music wing. And when you follow the dashed line, that's the post-intervention. So the stress level has come down. So their outcomes are music lowered anxiety and distress during simulation, during the intervention. And most importantly, the music they gave was culturally centered, individualized music. So they would definitely, these interventions, this music would definitely have a scientific backup, but they kind of, so basically, if we have a large repertoire of scientific articles on like Indian music or Mexican music and all of that, so as and when the patient comes, we can choose the music. So there is an option for choosing. So what they gave culturally centered, patient preferred music. So that tend to have more impact than music chosen by a music therapist. This is a meta-analysis from 2019 for cancer patients and what musical interventions had helped in cancer patients. So they have improved the quality of life, pain reduction, anxiety reduction, depressive symptom reduction. And then there are various articles on the cancer patients. And I think the most of the music therapy research is at least 60% in a clinical setup is done with cancer patients. This is an intriguing study. So music therapy in Alzheimer's. So the reason why I'm showcasing the screenshot of the abstract is that there are no pictures. So I thought of talking about it verbally. So music therapy in Alzheimer's disease. So in healthy individuals, activation by an intense and emotional response to music, for example, like a chills or goosebump, etc. When that happens, there is a lot of dopamine that is secreting into the body. So that is directly proportional to intensity of chills. So higher the chills and higher you are involved in the music and emotionally moved by the music, higher the dopamine secretion. So that increased extracellular dopamine levels could partly explain the cognitive and emotional gains induced by music in patients with neurological disorders. So music-induced improvement of mood, arousal, and relief of confusion might therefore enhance the recovery of cognitive functions in these patients. So that's also explains why it's used in Alzheimer's and dementia. So music-induced activation of parasympathetic nervous system and inhibition of the sympathetic nervous system in people with dementia, and corresponding changes in catecholamine and cytokine secretion has been considered as a soothing effect of music. And this increased parasympathetic activity is also possible mechanism behind the effect of music and how it ameliorates the neuropsychiatric symptoms in dementia. So this study was done in dementia, Alzheimer's patients, like mild and moderate. So in mild, I think there was significant improvement in memory, orientation, depression, anxiety, and moderate, the higher the symptoms. So the delusions, hallucinations, agitation, irritability, language disorders is significantly improved. And these improvement was found after like 4 sessions of music therapy. With movement disorders such as Parkinsonism, so music-based interventions that synchronize movement to music can be beneficial in the maintenance of motor performance in people with Parkinson's. So for example, like giving music is so much better than giving a metronome beat. That would be like tick, 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 tick. Usually people do that. So what studies found that the rhythmic use of musical stimuli compensates for the loss of control by the extrapyramidal system and enhances the audio perception and movement synchronizations. And as in studies of stroke rehabilitation, the use of music as a stimulus might be more effective than auditory stimulation without music, as I mentioned, like this metronome beat in gait rehabilitation, but requires further investigation. Post-operative, I think I have already discussed that before, but yes, pain and anxiety reduction in the post-operative period. This is one of the most interesting studies for me. So Mozart K448 Sonata is a beautiful piece. And in the last 2 decades, this intervention has been given on over patients, pediatric epilepsy patients all across the world, across the continents, and found that I think the frequency of epileptiform discharges has come down when you listen to Mozart K448. Deficiencies. I think in the previous slides I had mentioned the same thing. So we don't have an academic therapy training programs in India and many other countries as well. I think most of the third world countries, although we do have a large repertoire of indigenous classical and folk music, and there is a large plethora of, instruments, both classical and folk, but we haven't incorporated into the healthcare infrastructure as such. So no board certification, no professional body of music therapists, no randomized control trials. So last year, the United States celebrated 60 years of incorporating music into their healthcare infrastructure and also academic training program. We haven't even formed a fraternity of music therapists or fraternity of physician, musician, music therapists for setting the guidelines. Although there are definitions set out by AMTA, American Association of Music Therapy, I think each country would have their own individual guidelines, which is tailored to the diaspora, tailored to the continent, because I think there is a lot of cultural and linguistic influences, particularly for a musical intervention. Again, I'm not mentioning all of these in a disparaging way, but I think it's crucial to understand where we stand. This is a picture from Stanford. They have their therapeutic / passive music therapy. There is in the corridors, there is a beautiful harp or an acoustic piano, not only for the patients, but also for the physicians and residents. There in the resident lounges or in the hallways, there is a piano and many other creative expression interventions. Again, these are pictures taken out from the public domain. It is a little challenging to compare. I mean, I think it's unfair to compare the what is done in a country to another, but I think India houses 1/5 of world's population. But I think when we kind of acknowledges what we lack, and I think it will be easier to bridge these gaps. So we don't even have a PA system for even to give a recorded music. And now here comes my advocacy program, Oncology in Strings. So my target audience is medical students, paid and palliative care physicians, and oncologists, and how can they make an impact. So I talk about all of these, that where we stand at the moment, so that we can come up with, because I think medical students in India, I think medical students are the perfect best bet to do the randomized controlled trials. And I think like over 2.5 years now, there are many medical students who have started these randomized controlled trials right now. And now, I mean, with the guidance of their mentors and oncologists. Passive music therapy, this is something I think hospice and pain and palliative care physicians can do, because as we don't have, as I said, you know, a PA system or something of that sort, I'm recording music and kind of absolutely free of cost music and lending it out to pain and palliative centers, cancer centers, NGOs. And these physicians can either, I think if they already have a PA system, they can play the music. Otherwise, I think purchase. I think the infrastructure is a little bit different. We don't run on a lot of funding. So, but then there are individual funders, perhaps we can seek for. I think it's not that expensive to purchase like a 30 headphones or 30 earphones. And I mean, I have given it in my hospital. So I think it's pragmatic, like at the moment. So giving it to the patients using, headphones or earphones. Physician burnout, I think I cannot forget to mention this, as I have myself underwent this, gone through physician burnout. And after my, and music was really cathartic for me. And I was advocating about, you know, physician burnout and how it is important for physicians to, because of the heavy academic, the schedules, we often put it in the back burner, our creative outlets. So how to bring it back and embrace it like every day or as often as you can in a week or so. And at least in a week, I received one text message from a medical student saying that, hey, I gave my Veena/violin/piano, guitar for repair, because it's been a long time. I've been practicing music as a child, but you know, when I went to medical school, I kind of posted. So I'm invigorated to take it back. And yes, thank you. So yes, so we are working on three of these frontiers, and my music has reached over 10,000 patients. And these are the kind of institutions, government medical colleges, cancer centers, and NGOs, and where I couldn't reach physically, I've been virtually giving music and lecture concerts. Tata Memorial Cancer Center is one of the premier institutions from its establishment, and I've the honor of giving a talk on 2 days. And another one is a conference of international palliative care, just pictures. The relevance of music in the context of pandemic, I think the catastrophic resurgence of COVID-19 has, I think, given indescribable destruction to the country. We are filled with death and despair. And it's really challenging because in India, I think, according to World Health Organization's physician population ratio, which is 1:2000, that's what they have recommended. We are a lot shorter than that ratio pre-pandemic. And now with pandemic, we lost several doctors to COVID. There are many doctors who are quarantining or in isolation. So I think this gap is kind of further increasing, and the patient load is so humongous, and it's mounting. And the load on each physician is frighteningly high. And I think there were several researchers that's coming up on post-pandemic mental health issues. Yes, that's something to address. And I think low and middle income countries, LMICs like India, has even not acknowledging the word physician burnout, like pre-pandemic. And even pre-pandemic, I think even like globally, physician burnout was reaching a pandemic level according to our research. But with pandemic, obviously it has mounted. Now, what has second wave of COVID-19 has done to India, what you can see in orange is the official report. And we were told from the beginning by experts that, there is a substantial underestimation in the number of infections per day and the deaths. So what you can see on the top, which is like cow dung green, that is the excess deaths, and that's kind of supposed. And this measure, this is given by Institute of Health and Health Metrics and Evaluation, IHME. This is a picture taken by my dear friend Vandana. She's, I think, here today, and she was admitted with COVID, and she kind of saw this healthcare worker who was treating her like this. And this is not from a public domain. This is actually what she witnessed. And I think working for 36 to 48 hours sometimes on non-air conditioned, I think infrastructure with these PPEs, with this isolation and kind of ostracization from, I think, society as well. I think even yesterday we had a case of abuse on doctors, physical abuse on doctors, saying that you guys transmit COVID like that. And it was a physical attack. And so I think it's really challenging. And physician burnout is a term that was coined in 1974. Subsequently, it was described later by Maslach and colleagues. Chronic stress associated with emotionally intense work demands for which resources are inadequate can result in burnout that causes emotional exhaustion, depersonalization, sense of reduced personal accomplishment / imposter syndrome. So I think physician burnout, that is leading to a depersonalization. Perhaps that would certainly need professional counseling and professional help. But what I'm trying to say is perhaps what we can do artistically or like creatively in institutions and at an individual level. So what I advocate is to embrace your creative outlet. You don't have to be an expert in it, but whatever your creative expression or outlet is, embrace it as frequently as you can, because I think in life we kind of lose ourselves, and I think it's very important to construct a bridge towards your inner self. So that's kind of very important, be it whatever the artistic format is, like be it even cooking, stone painting, or gardening, anything that is. Organizational, I think last year I was part of two programs, initiatives. One is Stanford's Stuck at Home concert series, musical concert, and second one is Stanford Medicine's Writing Medicine program, which is a reflective writing medicine program. So there are many institutions, a large number of institutions, particularly outside India, that has come out with these initiatives at an organizational level, at a group organization, and also like builds a sense of, I think, sense of that someone is there, and it kind of enhances the resilience and tenacity. So I think, yeah, it's very important, but I haven't seen something that's coming up in India, but hopefully we will implement something soon, hopefully. So I think resident lounges in I think, countries with music therapy as an established profession versus the other one. Again, I think I'm just stressing it too much, but I have to say that I'm not mentioning it in a disparaging way, but it's very important to understand where we stand. I honestly haven't seen a large number of studies on COVID and the musical interventions or creative interventions in our databases. Perhaps I can speak for India, because even if we come up with something, physicians are too exhausted when they are back home in the end of the day. So it's very difficult to write a paper. But I think in a global perspective, I'll show you some interesting studies. One is from Spain. So they did so many interventions in their ICUs for the well-being of patients who to feel less lonely or isolated. So one of this was music therapy. And this, I would love for the entire world to have something of this sort. Like one patient, and there are, I think, 6 or healthcare workers for one patient and helping it out. But yeah, that'll be wonderful if we have it for the entire world. Receptive music therapy to reduce stress and improve well-being in Italian clinical staff involved in COVID-19 pandemic. That showed that when they listen to music, the tiredness, sadness, fear, worry tend to reduce. And when they listen to social media or news or media, any other media, this has gone up. One of the most frequent questions I've been asked is there a magical playlist for therapeutic music therapy, or even like passively listening to music? I do say yes, because it is that music that to which you can resonate the most. So I often find an allegory with cuisines. So you might have grown up with a cuisine like at home, and then when you suddenly go to Naples and discover like Italian pizza, and that's your new favorite, and you tend to you add it into your favorite cuisines and kind of consume it frequently. So just like that, I think I do agree that there are many parts in the world where people are not digitally literate, but I think for the lion's share, we do have a digitally literate population. So I think in the platforms like many other platforms, digital platforms for music, you can find music, explore these musics and add it into your repertoire. But the only thing whatever I have said, all these in the last like 40 slides, the most important thing, what we discuss in the frontier of music therapy, is that all of this is okay. But when for example, sometimes the music would be intrinsically so uplifting and happy. So when this music, a person is listening to this music when they were going through a devastating period of time, and phase in their life, and then after a couple of years, when they listen to the same uplifting music, they won't feel uplifted, because they are associating that devastating phase they gone through with the music. So what they say is kind of giving music that's most the person can most connect with the music would be the most, because whatever we have said, cortisol, neurochemistry and all of that is there for sure, but I think there is also a factor of memory associated with the music. So yes, that's important. So always patient-directed, patient advised music would be the most important, effective form. And if you would like to enhance your repertoire through Indian classical music, I can help. So Indian classical music is divided into 2, South Indian Carnatic and North Indian Hindustani. That'll be too much of grammar. But anyway, while Western classical music is based on harmony, Indian classical music is based on melody, which means that, which is analogous to mode okay, there is a musical grammar called raga/rag, which is analogous to Western classical music's mode, which is nothing but a set of specific 7 notes, or max to max you can have 7 notes, and or less. And any music that composed in this particular mode has to be within using these 7 notes in their various permutations and combination. And there are thousands of modes like that. So the point why I'm explaining all of this is because in our mentors have taught us that a particular mode can /raga can evoke a specific emotion. So for example, I'm not going to tell what it evokes, but I will sing it and show you. So for example, Magare ni re ni sa ni na ka I hope you don't find this uplifting. So this is something a little despondent, a little sad tune, /mode /raga, which is Pantwarali. And the second one is a really uplifting tune. Ni re ga, ni re ba. Mere gama bani sani do pa ma ba sani do pa ma ba da ma pa ma ga pa ga. This is Kalyani /Yaman. But I think I think in all the sessions I have conducted, I have received remarks that, oh yes, I mean, particularly from audience who are not musically trained, that, oh yes, I mean, that difference, that distinction is really stark. So I was just thinking that if we could come up with clinical trials on how on the clinical implications of these ragas, I think that would be a great addition to Indian the music therapy repertoire, which we could in future use for clinical music therapy. Okay, so I'm going to play music now. Give me a few seconds to get my veena.
Sure thing, Dr. Rajendran. And Dr. Rajendran, after your concert demo, we do have several questions, time permitting, from the audience also on the material that you shared with us today.
Sure, definitely. we can take questions, Priya. Thank you.
Yeah, thank you so much, Dr. Rajendran. That was very beautiful. Do you mind sharing with everyone what ragam that was and what you were
Yes, absolutely.
playing?
Absolutely. This ragam in Carnatic music is called as Kapi. In Hindustani music, this is Pilu. This is slightly an evening raga, and this has a little bit of devotion and a little bit of, I think, a small golden thread of despondency running underneath, but it's a gorgeous raga. So I like it. So
That was very beautiful. So we have
thank you.
many questions that we received throughout your presentation. So I'll just go with go from, find the question and ask on behalf of the audience. So the first one is from someone named Pranab Basu. So question was, different ragas at different times of the day, if I am not wrong, have different efficacy on patients with non-communicable diseases, especially cancer. Is the therapeutic effect on different cancer different?
Well, I think the first one I would be able to say with Indian classical music and I think that was based on ragas, right? The question.
I think it was based on ragas, but also if
in general,
does music have a different effect on different types of cancer?
Okay. But so I would start by saying that with Indian music, thank you so much for that question. So that's very important. And so with respect to ragas, I think, as I mentioned earlier, these are anecdotal evidences that we have, be it the time of raga, be it like the evening raga, morning raga, or the emotions that's going to emulate. These are anecdotal evidences. Yes, they are described in our textbooks, musical ancient textbooks from our mentors, etc., etc. That said, as a physician perspective, until we have a conclusive evidence from the clinical trials, we won't be able to conclusively state that there would be a specific effect on patients. That's number one. And second part of the question, whether this music will have an impact on patients differently and different cancers, I would say the impact is based on how it is really qualitative, and it might vary. I mean, not I'm discussing with respect to all the clinical trials we have on Western classical music or the existing clinical trials. These are very qualitative, and it's very variable. It is individualistic, and what music does is the anxiety and the quality of life, reduced quality of life, or mood disturbance, and all the psychological issues related with the patient. And I think this would have a lot to do with the person, with the individual, rather than the diagnosis, perhaps. So I'm not too sure if I could comment on anything, whether there would be any variation or something, but this is what I know at the moment. So thank you so much for asking that question.
Yes, and this question is from Galaxy F41. So I think they're referring to anything related to Parkinson's. So any research studies that you've come across related to music and Parkinson's disease?
Yes, absolutely. So I've shown during the presentation. So in Parkinson's, when you listen to music which has more to do with, I think, movements, and when you listen to a rhythmic musical stimuli or rhythmic music, and when you kind of try to, because with I think we try to the rehabilitation of Parkinson's disease, you work on the movement aspect, right? So that will have more impact when you use a rhythmic music versus when you just use a tune or like tick 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 tick. That's how they use apparently. I think that's one of those uses, one of those interventions. So instead of that, if we use rhythmic music, there are reports that it's found more effective, rhythmic music. Yes. So if you like to know more, maybe I can pull up some papers, articles, peer reviewed, and send it to you over email. Or maybe I can mention my email ID here.
Yes.
Okay.
And for anyone interested in the audience, if Dr. Rajendran, if there's any information you want to share with all of the audience members later, if you don't mind, please putting your email address on the chat, and then through Telavaid, we can share materials that Dr. Rajendran shares with us. So feel free to put your email also to the audience members. Next question. This is from Jeremy Daney. Jerome Daney, is it mandatory to be a trained music therapist to use music as a therapeutic modality in our clinical setting or to conduct research? Or is it okay to use music as a therapeutic modality if you are a musician? So I think what this question is asking is, if you're not trained as, say you're a clinician, but not trained in music therapy or not a musician, is it okay to start doing music therapy for your patients? And vice versa, if you're a musician but no background in music therapy, can you as a musician start practicing musical therapy?
That's a very frequent question I get. So that's the reason why I showed the definition of music therapy. So for example, let me explain like this. So for example, there is a hypertension, there is diabetes. How do we define all this? So when you go to a doctor says 120 to 80 to 120, all of that. How do you say, how does he say this is normal or whatever? So there is a guideline set by a fraternity, a professional body. So mostly that would be like American Cardiology Association, or any of those reputed guidelines. So they have taken years to find out a like proper guideline, write a definition, and we work accordingly. And they kind of revise these guidelines like every 5 years or 10 years or something of that sort. So we follow these guidelines. These are scientific. And so just like that. So I think in India and many countries, we kind of say any music, like if you're listening to music, oh, I'm receiving music therapy, or so that's like music therapy. The term, the connotation has as much gravitas as chemotherapy. So when I receive Tylenol, I won't say that I received chemotherapy, right? So just like that, we American Music Therapy Association, that's a professional body. So they have found out, written a definition. So according to that definition, we can only say music therapy when it is given or delivered by a board certified music therapist. So yes, so that answers if you're a physician or a musician, I think it will be challenging according to the definition to perform music therapy. But on the other hand, what you can do if you're a physician is passive music therapy. So if you have physicians play music, or maybe actually there is a questionnaire I can email to you. So you can ask the questionnaire, using the questionnaire, you can inquire what all musical genres your patients like to listen, and then create a mixture playlist and then play it like 24/7, even while sleeping. I've heard like in AIMS Delhi, they used to do it in the cancer wards like back in 1990, early 1990s. So you can do that, passive music therapy, but clinical, no.
Thank you, Dr. Rajendran. Another question we received was, can a patient in a vegetative state respond to music in any nonverbal way, specifically for patients with COVID-19 undergoing ventilation?
With when, sorry, Priya, can you read the first half of the question?
Right. Can
vegetative state, right?
Right, yes. So can a patient in a vegetative state respond to music in any nonverbal way? And then secondly, especially for patients, with COVID-19 undergoing ventilation. So I guess the second part, the patient generally isn't in a vegetative state. They're in a, induced coma or induced sedation, generally under ventilation. So I guess there's two questions in that. And to add to mine, have there been studies looking at patients in a coma or vegetative state, like any fMRI scans with music. That may be something, a future study to look at.
Yes, absolutely. This is a brand new question. So honestly, I haven't come across any, but that doesn't mean there are none. So I'm going to read up, and can you please put the email ID on the chat box so that I can reply to you personally, and I'll read about it and get back to you. I think that's very interesting that in a vegetative state, whether a patient can non-verbally respond to music. Wow. Thank you so much for asking that question. I think often you learn things from questions. Yeah.
Yes. And then we received additional question as well. So for a patient who is unable to listen to music, say they are hard of hearing, can music be felt? And will that work?
Music be felt as in live music or recorded music?
I would assume it would have to be live music or something that also creates some sort of material resonation or vibration. Yeah.
Honestly, I don't think, I haven't come across a specific paper that talks about this independently, but I have read somewhere in a peer-reviewed article, I guess, when they were talking about live music, and they have mentioned that there'll be, I think that's if they're close enough, I think it's a string instrument or something, I think there will be the transmission of vibrations, but I think their outcome was combined with, it wasn't a hearing impaired patient, so perhaps the outcome was both the vibration and the auditory. So I'm not too sure, but again, I'm going to get back. So thank you so much for that question. Wow. Okay.
That's
also, Priya, I would like to say that, when we initially spoke about the neurochemistry of music, I think all of that, the rehabilitative effect of music was from the starting point of that is how it's processed in the auditory cortex and the nucleus accumbens, etc. So, and nowhere it's kind of mentioned as something in any other sensory inputs. So it was predominantly, it was about the auditory stimulus and not with the tactile or something of that sort, so, or visual. But I would also say there is some other intervention in music therapy which I have read is guided imagery and music. So that would be something to explore for the hearing impaired. I'm sure there would be something, so I'll read that up and get back. Yeah.
All right. Thank you so much, Dr. Rajendran.
Yeah, it's wonderful, Dr. Rajendran. Tara, if I may call you, I think you have just shared with us a simple strain of your musical abilities and what music can do. And as we all know, music has been called different things, and the attendees have enjoyed and stayed through the program. It's a universal language. It goes beyond language. It goes beyond religion. It goes beyond cultures. It's a great healer. And it's a reflection of the divine, and there's no doubt about the power of music. And I think there's a lot more work cut out to do. And I should say we do this, at least in MD Anderson. There is this integrative medicine, and we do holistic approaches. Music therapy should be part of this, among other things, and not just for cancer patients. I think for people in general, especially for the entire humanity, 8 billion people going through this pandemic. And getting everything, the different moving parts in shape to get back to 2021. That's been hard, but I think music is one thing that's helped us all. So thank you for the good work, and we will continue to have these discussions. Thank you.
Thank you so much.
Thank you all, the attendees, for coming at the late hour of the day in India. And we hope you enjoyed this, and feel free to email any one of us or ask Dr. Rajendran for more questions, and I'm sure she'll be happy to share some of the music and the questions that you asked. Thank you again.
Absolutely. Thank you.